Hospital for Special Surgery is focused on musculoskeletal medicine. So that's orthopedic diseases and condition. Traditionally started as a surgery hospital. It's the oldest orthopedic hospital in the United States, but there's also expertise in rheumatology and physical medicine. And radiology and imaging becomes part of that. Imaging is a key element for musculoskeletal medicine. Anybody who sees a musculoskeletal medicine provider usually gets some type of imaging examination, whether it's an X-ray, a CAT scan, an ultrasound, or MRI. And that's something that we do a lot of at our hospital. We have a large deployment of MRI scanners, CT, ultrasound, many X-rays, radiographs that we do every day. HSS has one main campus in Manhattan. However, we have several regional sites that go from Connecticut, New Jersey, Long Island, and starting in Florida shortly. So it's important to be able to have a system that can perform across the whole enterprise. When Hospital for Special Surgery was looking for a PACS vendor, they looked for a vendor that was able to provide a functionality that not only suited radiologists, but was also suitable for our referring providers, such as the orthopedic surgeons. So the Sectra PACS was really wonderful in the sense that everybody in the enterprise uses the same PACS. So we all have the same look and feel of our user interface. The system has one archive that's deployed across the whole enterprise, so we don't have to build redundant web archives or other archives. And it's also provided very good performance. In addition, Sectra has an area that's particularly focused on orthopedics. So they have a division for orthopedic tools, and so our orthopedic surgeons were very interested in using the tools for things like measurements and doing templating for joint replacements. And now they have a new product that's 3D ortho tools. So enhancing their current product and also adding to that is something that's very exciting to our surgeons. Adding modules for things like spine has become very important, helping our trauma surgeons do planning from their 3D rendering. Since we do a lot of exams all throughout the week and read over the weekends, we need something that really has a high reliability. And then I think most importantly is the user interface. So being able to have a navigational model and a user interface that's intuitive and easy to be able to look at patient exams, compare them with prior exams, bring in outside exams. So HSS certainly has a vision about they want to be the premier musculoskeletal medicine provider, and we also like to partner with companies that also have a vision. So partnering with Sectra, who has a vision for orthopedic imaging and orthopedic tools, is very important. We found the relationship to be mutually beneficial. We're able to work with Sectra to get some of the tools and workflows that we want into our environment, and I think Sectra has benefited from working with the premier orthopedic hospital where we have a variety of providers. We have many surgeons, and their surgical practices are a little bit different. They're all individuals, and so gleaning insight from a variety of different orthopedic providers I think has been very beneficial to try to come up with a common model that would be suitable for customers at HSS and also outside of HSS. It was about 2 years ago we decided that we wanted to have one electronic medical record. So we decided to go with one of the vendors, Epic. And so Epic provides our main information system. And it was very important to have a partner on the imaging side that would integrate well with that vendor. And so this relationship has worked out quite well for us in the sense that using Epic for our EMR allows Sectra to provide the medical imaging visualization. So when a user is in Epic and they want to see medical images, they'll open up a PACS, the PACS window to see them. And it's also that Epic has had a good relationship with Sectra in terms of development. We know that Epic and Sectra developers work together, and we find that that's a key relationship. So at HSS, our goal with implementing the Epic hyperspace was really to provide one record, one patient, one HSS. And so we wanted to have one single area that would be a source of truth, that would be one data repository for all of the key information related to the patient, and also provide a workflow environment for the majority of our providers. So they would be within one navigational model and user interface for dealing with the patient information. It really comes down to saving resources, and the types of resources that you save is not having to maintain multiple different information systems, not having to worry about those interfaces that break down, and it provides one uniform look and feel to the enterprise. It allows other providers, so a number of our referring surgeons actually work in private offices, and allows them to get Epic in their office and have the same look and feel on their office EMR as they do for the hospital EMR. With using the Sectra Image Exchange portal, or IEP, what it's allowed us to do is to bring images very seamlessly and facilely into our PACS environment using our EMR. So what I mean by that is that the electronic medical record, Epic in this case, drives our workflow. The IEP allows us to bring images from outside media, such as CDs or USBs, and to upload it into our PACS directly, with Sectra PACS, and also have all of that information populated within our Epic system. It's not something that's simply a radiology file room function. It's something that offices, nurses, physicians can do. It's something that allows point of care uploads when patients come in to see their providers, no matter what campus they're on, which one of our regional sites. It's not something where you have to drop off CDs at the file room and wait several days for them to be uploaded. It's easy to use, so there's a brief training module that people go through and start uploading cases. We've seen our volume of uploads increase. We've seen a decrease in our previously used cloud sharing software, so we let this come in organically, so we didn't shut down one system and turn on the other system. We deployed the IEP and watched it grow organically, and all that has been very successful. Our next step for using the Sectra IEP is to have a direct patient upload. So we are having our patients register in MyHSS, which is an Epic cloud-based software. And we would like the patients to be able to upload their outside images even before their visit, because sometimes this becomes crucial as to which provider they should see, or whether they should be seen by a provider, or whether some additional imaging might be needed prior to their visit. So Sectra is working with Epic to develop this MyChart integration, so that a patient at home could upload their images from their computer or CD or USB. I think when we look at our Sectra PACS, we find that it's highly usable across a wide range of users. So it's widely embraced not only by radiologists, but orthopedic surgeons, rheumatologists, and the workflow model has really endured, has worked better for us than some other types of workflows through different information systems. And I think that's one of the main credits to the company.